Hello, and welcome to tonight's League of Women Voters Wichita Metro unit meeting. We are so excited to have you here tonight, and we're really excited to share more about the Mental Health and Substance Abuse Coalition and their latest report. My name is Kate Ham, and as you know, I'm the Virtual Advocacy Chair here at League of Women Voters Wichita Metro. Tonight, we are super fortunate to learn more from the Executive Director of the Mental Health and Substance Abuse Coalition, Dawn Shepler. I'm really excited to share more about their mission, and she'll share more about the report. So the Mental Health and Substance Abuse Coalition is to create a virtual one-stop shop that serves people who are in crisis from mental health, substance abuse, or homelessness. At the center of the plan is strengthening the capacity of the Community Crisis Center and creating individual plans of care and ensuring that those supports needs such as transportation, medical costs, and viable workforce to meet the needs today and in the future. This coalition is made up of a lot of really awesome people, but leading the helm is Dawn Shepler. She joined this past year through the Mental Health and Substance Abuse Coalition. So Dawn, welcome tonight to our meeting. We're so glad to have you.
Thank you. I'm excited to be here.
She's going to go through some brief presentation and then we'll ask questions at the end. If you have questions throughout this, don't hesitate to drop them in the chat. We're going to have a lot of really great discussion. So Dawn, take it away.
Well, thank you so much. And I'm extremely excited to be joining you this evening. I want to give you a presentation of kind of where the coalition came from, where it's at, and what our plans are for moving forward for Sedgwick County and the residents of. So we're going to start out with just a little bit of a history lesson in reference to the coalition. You can go ahead and forward that slide for me. Thank you. So in 2015, our crisis center opened. I don't know how many of you remember, but back around that time frame is when Osawatomie had to start minimizing their patient population to become state approved. They had some struggles. And so each county was then put to the task of trying to figure out what to do with their populations within their specific counties. Sedgwick County had ComCare and SAC joined together and created the Crisis Center that provided all kinds of different programming. It had immediate substance abuse attention and services. It had crisis services that could refer for short stays for individuals. It could refer on to a few day stays for individuals who were needs of crisis in the community. The hospital was also an option. However, the possibility of individuals going to the hospital seemed not to be as frequent as it had been in the past. By 2018, we realized that we were in need of improving our services here in Sedgwick County. That's when the Mental Health and Substance Abuse Coalition formed. It recognized the community needs for crisis, both for the mental health and the substance abuse population. The coalition formed to focus on collaboration with community providers to better support those in crisis. Next, in 2019, they started focusing on a strategic plan. This plan was working towards a one-stop shop, focusing on strengthening the capacity of the Community Crisis Center, creating an individual plan of care, and ensuring that supports such as transportation, sharing medical records, and a viable workforce that can meet the needs today and into the future. Finally, we are into 2020, where the Public and Policy Management Center was hired to assist to work with the coalition. The coalition was needing some guidance. They sought the assistance from the Public Policy Management Center to find some guidance and structure. It was a natural and the next momentum to get the next step or the phase of the strategic plan. You can go ahead and flip that slide for me. Thank you. As you can see, this is our mission and our vision. I'm not going to read this to you. I'll give you a moment to look at it yourself. I do want to tell a little bit about my story while you're reading. I came from a law enforcement career. I've been in law enforcement for approximately 30 years now. And I have worked with the severe and persistently mentally ill, as well as those who are struggling with a substance use disorder. While working with this population within the Department of Corrections, it was very difficult to assist individuals when systems were not there to provide a warm handoff. They were distant, they were setting appointments out for the future. And I, as an individual who was trying to assist these individuals in the community that had crisis, as an advocate, was struggling too to make sure that these individuals received the treatment that they needed. So it kind of fell naturally into place when this position came open as the executive director, working with those same partners that I had been working with for so many years in moving forward with these strategic plans and goals. We can go ahead and move on towards the next slide. As you can see on our coalition board, we have multiple individuals that are comprised of elected officials, business partners, and community providers. Without this strong board, we wouldn't be able to move forward with the strategic plan for Sedgwick County in making sure that we have the appropriate tools, resources that we need for those that are in crisis for mental health and or substance abuse use. We can go forward to the next slide. Thank you. These are a list of our community members, the coalition members that assist, that support, that work with. This list is a little bit outdated. We do need to update it. So there are several more people that we could add to this list. If it was not for the community members and the supports in the community, we definitely couldn't move forward. Every individual that is in crisis has their hands on at least one of these services that helps them stabilize in the community, helps them move forward in the crisis. We want to work with these individuals so that the resources are available, that there's that warm handoff, and making it easy for the providers to provide their services that they have for those individuals. We can go ahead and move to the next slide. Thank you. This is our website. We are official. We actually just received our 501c3, so we are extremely excited about that. We do have this web page that is available. The link is, as you see on the screen. From this web page, you can find resources that we are working with, the task forces that we are focusing on, any training or event socials that we have coming up. And I would like to put a little plug in right here. We do have our community update coming up May 5th. It'll be in the morning of that day. So be on the lookout for that. If you are interested, you can email me. We will have my email at the end of the session. You can email me and tell me that you're interested, and we can send you that link to get signed up for that community update if you would like. You will also see our list of partners and any information that has put us where we're at. Any reports that we've had compiled, information that we've gathered to bring us to the point to where we are today. There is a little bit about us and definitely our contact information, which you can make contact with me also from this location. When we talk about individuals that are in crisis, we tend to fix and focus on the crisis that's right at hand, the crisis that we can see. But if we think about it, much like this analogy here, we're going to say that there's an individual who's in the water. He's downstream in the water, and a citizen jumps in to pull this individual out of the water because it's dangerous for them. Well, they see another individual in the water, so someone else jumps in to pull them out of the water. Pretty soon, we have several people jumping in to save several individuals in the downstream motion of this river. Pretty soon, we see an individual running upstream of this river, and someone says, "Why are you running upstream when everyone is downstream?" The person turns to them and says, they have to be coming from somewhere. We have to find that point of origin where we can stop it, fix it, so that we don't have that problem of individuals struggling downstream. So when we think about it, we want to look at the crisis situations. We want to see where those crisis situations are coming from, and that's what the coalition focuses on, so that we can work on fixing that instead of just consistently being reactive, moving forward to a proactive stance. You can go ahead. Thank you. As you can see here, there's several components of the Mental Health and Substance Abuse Coalition. While we know that each of these are extremely important and are in need of support, we're solely focusing on the crisis part of the continuum. We can go ahead and move forward to the next slide. Thank you. So when we're focusing on that crisis center, crisis point of the continuum, these are the points that we're going to be looking at. We're looking at coordination, communication, and collaboration, access to care, and workforce. In 2019, a strategic plan was developed. In the strategic plan, these three things were focused within that plan. The first is to provide tools and opportunity to providers and better connect them to the community individuals that are in crisis so they can do what they're great at. Number two is to reduce barriers so people can get to services they need when they need them. There are 4 subcommittees that we currently have that assist the coalition by targeting specific tasks that come together as a whole for the board to work from. And last but not least, we definitely want a working group, or we're working with a working group from the KU School of Medicine. And this is so important. Why? Because ComCare is approximately down about 42% of their staff. That means that they have approximately 42% of their staff or positions open. And this is definitely not a problem that can be fixed overnight, that we want to focus on, that's going to fix today and work towards the future so that we don't have to keep coming back to the stance. We're looking at staffing preventative programs so that that we know that work. You can go ahead and forward. Oh, there you go. Thank you. So we're going to divide this into 3 areas. The first is the technology and virtual services. This is a shared database to improve patient care. So if you think about it, if we could have services or a database that provides that information to individuals so they don't fall through the cracks, that is HIPAA compliant, that we can share information with just as much as we need to know so that we can assist that individual so that they have that warm handoff, so that they don't fall through the cracks and are forgotten about until their crisis increases. We also want a front door point of contact for clients. We want somebody right there so that we can have them kind of triage their immediate crisis situation. We're going to look at all the situations that they have going on, or crisis that they have going on, so that we can move forward through the services that we will be providing at the one-stop shop and get them stabilized and back on their feet. We want to eliminate barriers to comprehensive care. So that's that warm handoff. We want to be able to make sure that we can provide an individual coming in with close to, or if not immediate services, by walking them down the hall or walking them across the street to that service provider so that they can get that help that they need. The physical campus, this is going to be a shared physical location for service providers. It's going to have a central location. We're going to be able to share resources, again, eliminating barriers to comprehensive care, giving that warm handoff. This is going to be able to house several individuals that make up the treatment or that care for those individuals in the community in crisis. And last but not least, we have our strategic initiatives. We have our policy that we have sent off to the legislator, focusing on workforce. That is our number 1 priority right now, so that we can make sure that when we do increase, or the services that we're providing now can at least staff those resources or those service providers so that we can get people the care that they need. If we have buildings but no staff, it doesn't do us any good. We also have housing, transportation, workforce, and community partners that are all part of our strategic initiatives. Transportation is part of our barriers that we're focusing on now. We are currently running a pilot program for that. And again, workforce, it was our number one legislative priority that we have been pushing for. And working again with community partners. If you remember back on the slide where it showed all of the community partners, we definitely could not do this without them. The next item I want to talk about is the concept of the physical campus. So there's some great examples out there. The most well-known is the Bexar County in San Antonio. Some people have traveled to see that operation and are extremely excited about what services they provide. The idea is to have an area where people can go and have a wraparound service that provides multiple services in one place, receiving at the same time. We're working on this plan now and working with multiple providers to determine what will work best for the citizens of our great county and cities. It's extremely important for our campus to work together with the community providers. If we don't have those community providers housed within our services or available for resources, then we're missing a lot of those crisis steps for those individuals. You can go ahead and forward. This screen is pulled from a survey that was completed with the high utilizers of the behavioral health here in Sedgwick County. There were 516 patients that were reviewed, and the following is what was found. The study was done by the Public and Policy Management Center of Wichita State University, and we found that the population majority were the white males between the ages of 35 and 54 who reside in the downtown Wichita area. $17 million in patient care was funded by public assistance or uncompensated care for high utilizers of behavioral health funded by the Kansas Health Foundation. These patients suffer from serious mental illness and often have a multiple diagnosis or a complex physical, behavioral, and social needs struggle. High utilizers, are defined as adults with 2 or more hospitalizations in 1 year or 10 or more emergency department visits in a 4-year period. This study reviewed that 516 patient records from the years of 2015 to 2018 were utilized one or more of 3 Sedgwick County providers of health services, including Ascension Via Christi, ComCare of Sedgwick County, and the Substance Abuse Center of Kansas, also known as SAC. The cost shows that $56 million was spent in patient care. Remember, we're focusing on 516 individuals or patients. A 3-year cost for one individual was $527. Next, the annual cost for one patient was $36,175. And to be broke down a little bit further, the daily cost was approximately $99 per patient per day. If we can target these high utilizers, those that are in crisis, we can start minimizing the amount of the uncompensated care and funding by public assistance to put forth more services that will provide services for everyone in the county and not put that strain on the systems. This study examines the cost avoidance impact of the Community Crisis Center. So remember in 2015 when this was established, this includes services by ComCare and by SAC, or the Substance Abuse Center of Kansas. The study assumes that 20 to 30% of the crisis center admissions would have received hospital treatment if the community crisis center was not available or did not exist. Now, looking at the difference in cost, it is showing that to be $181 per patient for a 12-day time frame. This cost is approximately $5,490 per year per patient that has been saved. So already we are focusing and looking at how do we assist the most patients in the or most patients that are coming through the doors effectively, efficiently, and with good or better outcomes. How backed up and horrible our stats are. As you can see here, we are significantly understaffed and continue to be understaffed. We'll give you an example of what it looks like for an individual who has been waiting to go to Larned to be found competent enough to stand trial. So there's currently, at the time of the slide, 30 people waiting to go to Larned for competency. There was one individual that had been in the Sedgwick County Jail for 347 days waiting to go to Larned to be found competent. If we had more resources and services in the community, pushing for that regional state hospital located within the central Kansas area, we could have eliminated some of these individuals waiting so long to be found competent. We're looking for a reduction in the high utilizers, as we've said before, for both emergency room and the jail, who are in mental health and or substance abuse crisis. We have implemented programs and services within the community, such as the ICT-1. We've had CIT, which is the Crisis Intervention Team, where law enforcement is trained in working with individuals in the community that are struggling with mental health crisis. The ICT-1 program is a program where law enforcement, a case manager, a therapist or psychologist, psychiatrist will go out and meet with an individual in the community that is in crisis. This program is shown to be extremely effective. However, with staff shortages, the program is not able to grow at this point. And last, looking at collaboration. Again, working with the community members, the community providers is extremely important. There have been so many people that have engaged with the coalition that are not seen on a day-to-day basis that we could not do this work without. In the past several months, we've had so many organizations assist with subcommittees, bringing their expertise, working together with other resources and agencies and organizations to help us move forward. We have to remember that this is a community issue and we need a community response. We need this to move forward from a short-term program to a long-term impact for the residents of Sedgwick County. Here is our information. I am actually housed in on the Wichita State campus in Lindquist Hall with the Public Policy Management Center. If you have any questions, do not hesitate to email. You can write my email down here, or you can go to our website and find my contact information from there.
Dawn, man, I am blown away by the amount of information that you all have gathered, as well as the passion and compassion you have for those in crisis. This is fantastic. Also, all of their contact information did just get put in the chat, so you easily can click right there and be able to chat, be able to email right away or be able to find great things. As well as earlier in the presentation, you probably saw us put in the chat the link to the Mental Health and Substance Abuse Coalition website. So easy peasy, you can click and go immediately there. So this is the time that you get to ask questions. So I always have 50 million questions, as you all know. I'm always curious. And so I have a few, but this is a great time for each of you to bring your questions to the table. So go ahead and pop those in the chat whenever you're ready. But I just have a few first that we can start with. So
Okay.
I know you guys talked a little bit about how there is a shortage of mental health professionals within
Yeah.
the Sedgwick County community. I think nationwide we're seeing just kind of a lot of medical professionals and mental health professionals. There's a shortage because there is a larger demand now than there was in the past. What things are we doing in the community or different areas there that we can really support you all, or what you all are doing to make sure that we get more mental health professionals in our community?
So we're looking at everything up into potentially a STEM program for
Mm.
younger students, going into the schools and talking about the importance of working with social programs, being that social advocate. We are also looking at what can our state, so if you have any contacts with your lobbyists or legislators, this would be a great time to push that forward, where I know we're running out of time on that. We're continuing to push forward with that to see what options we have as far as giving some leeway with programs, or having community providers maybe even give a couple of hours of study time for students during their work week. I mean, we're looking at everything from the STEM program to our state representatives to hopefully increase the number of behavioral health and health staff within the state of Kansas. So if you have any ideas, don't hesitate to send those our way, because we're definitely looking for any kind of support or ambition that we can move forward on this. So
Totally. I think it just reminds us how much, I mean, as we all are really passionate about voter education and voting, and how much that ties back into it. That, we have a lot in our legislature that holds a lot of how we interact with each other in our community, in our county, our city, all of those pieces at that state level. So I think that's it circles back to where we kind of all are, where we can advocate for each other through our legislature. So the idea in your guys' whole mission of bringing a centralized mental health program together is really exciting and really cool. I know you talked a little bit about San Antonio and some other places. Your guys have looked for some really cool successes. Are there any cities in Kansas or other places that you guys are drawing some really cool inspiration from?
There is a program in Tulsa. There's a program in Colorado. So we are looking at all different types of services. We don't want to reinvent the wheel. We definitely want something that is going to fit with our community. Again, talking to community providers and organizations is huge. I cannot express that enough. And working with the clientele that comes through. What needs do they have? What resources can we provide? Do we need to implement new resources or more resources? So it's definitely something that we're tailoring for our Kansas residents within the Sedgwick County area. So, yeah.
That's awesome. It's cool to be able to see success in other places, but also be able to know what our needs are back home and be able to bring us all together. That's really great.
Absolutely.
We got some questions from the audience. So there was a couple of things that asking for like some on all the acronyms, because like as we know, there's always tons out there.
Yes.
They were like what AVC might stand for, and then they've got the CCC Care Center or in PPMC. Can you give us some? I'm going to pop this up on the screen. Can you give us some just insight to what some of these acronyms stand for?
Yeah, absolutely. So AVC is the Ascension Via Christi. So we're looking at St. Joe, St. Francis, all of the Ascension Via Christi facilities that are within the Sedgwick County area.
Oh,
The
awesome.
CCC Care Center is the Community Crisis Center. So that's going to be the Calm Care Center that's currently on, I believe it's on Main Street. It's right next to the Sedgwick County Courthouse, the parking building.
Mm-hmm.
And then the PPMC is the Public Policy Management Center that is housed on Wichita State campus and led by Misty Bruckner.
Awesome. Yeah, and she's the individual that is within your counterpart. She's also in those comments as a great person to email if you wanted to get more involved in spaces and somehow you missed Dawn. She's a great person as well.
Absolutely.
So we've got another question here. It says, are you working in any ways within the high schools on intervention? We talked a little bit about adults in crisis, but what about high school students?
So we have to remember that we are focusing on all of Sedgwick County. And so our resource center will have that focus for any age coming into crisis. It's not going to just be set for adults. Just like what ComCare is now, ComCare doesn't just focus on adults. They do have those services for individuals that are under the age of 18. Mm-hmm. So as far as working with high schools on interventions, I can see that as being one of our barrier task force possibilities as we start moving forward through this. It is definitely one of those things that has become an issue within our community, and trying to help those individuals that are in school and needing those services. COVID did not do us any justice and has really had an effect on all ages, and those numbers are consistently increasing. So we want to be able to provide those services for everyone as we move forward.
Definitely. I think that's great, especially as we know that our youth, like you said, going up the river, figuring out what's going on to be able to pull people out before, help people before they even get in the river, knowing that an adult in crisis might have started as a youth in crisis. And
correct.
So, yeah. Really helping with that whole, I don't want to call it a pipeline, but be able to help those students that are needing help then, so that we don't have issues later. That's awesome. I have someone that had a question like, what's the timeline for the physical campus? Like, we're jazzed, as you can tell, about this physical campus. It seems really cool.
We are super excited as well. This is not going to be an immediate reaction or immediate fix. This is something that there's a lot of moving parts to. And we're looking at a 3 to 5 year outcome for the campus. And that's pretty much all I can really talk about now, except for what services we've looked at. If you go into our website in the information page, there is the information link. There is a report. It's called the En Banc. And that En Banc report was provided to the county and city administrative staff, talking about where we're at with our coalition, talking about the campus. It gives more of a layout. I would really encourage you to go out and look at that report. It is a rather long document. I think it's around 50-ish pages long. So there are some large pictures in it. So it's not all just text, but it definitely has some really good information moving forward with the coalition, how we're going to work with the community, etc.
Definitely. And I just popped that in the chat. So if you're like, I want to go look at it right now, go for it. It is there and ready for you to click on. So it's got a lot of really great information there. So we have another question. We have a lot of people involved within our community in lots of different spaces and not just here. So how do community partners get connected with y'all? And like, is there any rules or anything that we should look for when they're kind of governing those relationships?
So right now, we do have our board. That was the page with all of our elected officials, our business partners, everybody on it. We do have those individuals as our board. However, we do have our coalition support members, and anyone can be a support member. And what happens with that is you will get regular updates. We're going to start doing those monthly. You'll receive invitations to events that we hold in support of the coalition and the individuals, supporting those individuals that are in crisis. Email me your information and I'll put you on that distribution list for sure. So
that's awesome. I know especially the best way for us to all work all to be able to tackle these issues are together. So being able to, be a part of that larger coalition is awesome. Right. So I had somebody else added the question. Sometimes we notice that our like healthcare providers, we notice that it might be a Kansas issue. Like we
Mhm.
might Colorado or Missouri or someone, our neighbors might not have the same issues as us. Are we noticing that the mental health providers, like lack of mental health providers that we have, kind of the shortage? Is it everywhere? Is it just Kansas? Tell us more about that. Are you seeing?
No, unfortunately, is not just Kansas. There are several states that are struggling as well. Um, and if you've noticed, there's everyone is struggling with workforce. And
Mm-hmm.
for a while there during COVID, it was, oh my gosh, this state is offering this amount of money, but my state is not. And so I'm going to go down here. And so we're just trying to find the best fit for our staff, recruiting staff, getting staff prepared to take on these roles here in Kansas. Again, we're moving forward with our workforce initiative with our policy for legislation. So it is definitely not just a Kansas issue. It is all around.
That's good to know that we're not alone in this. Sometimes, I think we think, man, us Kansans, we've got too much space and not enough people in it. And but I'm glad that we're putting forth initiatives so that we won't be stuck in this place for forever. That we're going to be able to be on the forefront of changing a lot of things. Um, so we have a member that was asking, when it comes to people in crisis, especially the homeless population or the people that are housing insecure, are we noticing it's a lot of veterans, or is it a different swath of our population that is having some more of these issues?
So that's a really good question. And that question gets asked a lot. We're definitely not trying to take away from the VA and the services that the VA provides. Um, they are their own entity and they provide a lot of amazing services. We're just trying to provide for those individuals that don't have access to those services
Mm-hmm.
within Sedgwick County. As far as the homeless, not everyone who is struggling with a mental illness and or a substance use disorder is homeless, and not all
Mm-hmm.
homeless are struggling with a mental health and or substance use disorder. So those populations, there's going to be an overlap with all three at some point. If you think about three circles that kind of come together, there's going to be that center point where there's a possibility of that crisis going on. Now that crisis may go out a little bit, but this campus is really focusing on that mental health and substance use disorder crisis situation. We definitely are working forward with our homeless and have set out strategic thoughts and processes for that homeless. And it is even addressed in the en banc where you can gather some more information about the homeless population.
That's awesome. I think it's sometimes I think we in our world we kind of assume different places of why people might be in different situations, but knowing that as a community we're coming together to help anybody in any of those situations wherever they are is really awesome. So somebody was asking a little bit about what services are currently offered in our hospitals. So is it assessment services? Is it, services for people like inpatient bed services? Tell us more about maybe how our hospitals are helping and then kind of how this might be a little different.
So every hospital has a little bit of a difference, right? They're not going to provide all of the exact same services. I do know that at St. Joe, we have our assessment center, which a long time ago used to be Good Shepherd, and it was over on Orm Street.
Mm-hmm.
It's been enveloped there at St. Joseph facility, and they do have a set number of beds that they can provide services to individuals. But again, it's just like any other services, like the hospital, state hospitals, Osawatomie or Larned. There is a wait time, there's a lag time of individuals getting from the ER or the emergency department up to a bed just because beds are not available. And so trying to figure out how to accommodate and work with all of the individuals that are in need in the community. And again, going upstream to figure out where our crisis problems are falling through, where we can put forth our most effort so that we can have that proactive stance to minimize that reaction or that significant crisis going on.
Definitely. That's awesome. So, some more really great questions.
Okay.
What are ways that groups like us, like League of Women Voters, we're passionate about mental health in our community, and we know that substance abuse is a part of that as well. That can, you know, that there can be a lot of mixture between those two. What can we do as our group to advocate, help raise awareness, and really support the work that you guys are doing?
So, again, we can definitely put you on the dissemination list. If there's something coming up that you feel that you guys are working on that would help support us, we would try to show up. My schedule is filling up super fast with all speaking engagements and all of the work that we're trying to do within the coalition. But if there's something specific that you have working on, maybe we can team together, find another member to team together with you and support that, or put that into the community so that we can gain even more support. I do know that now that we have our 501c3, we will be looking for donations, looking for support from the community to move forward with the plans. So.
Awesome. That seems awesome. I think a great way, especially bringing attention to it. I think one thing that we love to do is people, rather than creating two of the same things, is really spotlighting people, groups like you guys that are doing the hard work and doing the good work, and then encouraging members and people to follow along and show up too when you
Yeah.
guys have your events. I think that's one thing that we all do really well together when we show up together.
Yes.
So a couple other questions too. We've got a really wide array, which is awesome.
Yeah,
So
it is.
so like, how many individuals, even like people that are under 18, like self-refer into your services? What does that look like?
So, well, it depends on what service you're talking about. We're working with ComCare, we're working with SAC, we're working with Open Door, Humankind, URM. We're working with all kinds of Ascension Via Christi. So it depends on what service you're looking at. And as far as self-referrals, I really don't have those numbers. I do know that the intake into ComCare is significantly high. Those going into ComCare, not all of them are emergency crisis situations. And so that one-stop shop can definitely help triage those and get those to the services that would best fit their crisis situation. Hopefully freeing up that time that crisis services such as ComCare, SAC, or Ascension Via Christi are typically holding and taking care of individuals can spend more time on those that are in crisis.
Definitely. I just popped into the comments for y'all. You're going to see it in just a second. Is looking at that one-stop shop. Again, it's on their website, but it's in their resources section, and it is a long list. It's awesome of how many resources are available. So if you know somebody that is in crisis, or you have a group of people that understands that where people might be and might be able to disseminate this information to people in crisis, I know that's an awesome thing. So somebody was asking a little bit more about ComCare. Is ComCare private, or is it a public institution? I assumed it was public, but maybe I'm crazy.
No, it is a public entity here in Sedgwick County, and everybody is working so hard to provide as much as they can. I know that the director, Joan Tammany, is very passionate about her staff. She is doing what she can and consistently pushing forward, helping and trying to help bridge those gaps where they can. So
Definitely. So another person asked, is this something that we should also be talking to our county commissioners about? Is it city commissioners that city council members that we should be talking to? Is it county, or is it truly the state? Where is the best way for us to spend our time when we want to advocate for these resources?
I would say state right now. They are still in session just for a short period of time, I know. And as far as county versus city, we are super blessed to have both representing on the coalition. I don't know if you got to see that quickly, but we do have Commissioner Dennis and Commissioner Cruz on our coalition board, as well as City Council Member Tuttle and City Council Member Ballard, all representing each entity on our coalition board. So, and it doesn't ever hurt to have those great conversations with anybody that will listen. So,
Exactly. I think it comes back to um, where our votes go is really important, and being educated to know that if mental health, especially for us, we know as an organization, mental health is one of the priorities that we're thinking about. But for each individual watching or watching us later or whatever that feels like, if mental health is important to you, understanding who, finding your commissioners that are on there and voicing your opinion to them, because especially if you're in their district or in their wherever you are in their district, I guess in their district for both city and county, and share with them that you're passionate about it, and also voting for those that are also passionate about it if that is something that's important to you. Um, so this a question that popped up is sometimes you can't force people to take medication that might be able to help them, regulate their emotions better or regulate how they interact with society. Is this in the program? I know that it's also, there's not always those opportunities, but what ways can we, is there support for people within medications and within that kind of support area?
so that is a very good question, and that gets brought up a lot. Um, for individuals that are prescribed a medication to assist with their symptoms that they might be having from a diagnosed illness, it's no different than somebody who has a physical illness. Are they wanting to take their medications or not? A lot of times, individuals aren't wanting to take their medications because of the side effects from the medications. Um, there's a whole slew of reasons why people don't take medications. It could be cost, it could be even just having access to them. It could be it doesn't make them feel good, the side effects of it. And so this is where communication and education about when their diagnosis to what the medication really does for them and how it can help. As well as when somebody is taking a medication, having that consistent conversation. So I know that with ComCare, when somebody's given a medication, there's a follow-up appointment to talk about, hey, how is this medication working for you? Because, you and I can have the same diagnosis. However, we could be on a completely different medication just because of the makeup of our body. And so they're going to work with what is the best acting at the moment, at the lowest dose, according to that person's demographics, their size, their weight, their health, etc. There's all kinds of things that are put into play when they're looking at a medication. And so if you have someone in your life that is struggling with a mental illness or symptoms or a substance abuse disorder, I really encourage you a couple of things. One, study up on the diagnosis, read all about it, informing yourself of what that diagnosis looks like. Again, it may not be identical to what you're seeing with your loved one or the person you're supporting, but it'll give you a better idea and understanding. Two, the NAMI program, the National Alliance for Mental Illness, is an amazing program. It is nationwide, and we do have it right here in Sedgwick County. And they provide programs such as the Family peer to support groups, where you can go in and talk. You can have that person that's giving you instruction or just having that open group session who has gone through the same thing or similar things. So you don't feel alone. You can get some guidance. You can get some instruction on how to handle it or better care for it. This is exhausting. It can be very exhausting. And a lot of people tend to burn bridges when they're not following along with their treatment recommendations. And so those are just a couple of ideas that you can take.
That's awesome. I put NAMI into the chat as well, just because it is a really great organization that does have a lot of resources, and I think that's the best part is that all of us have pieces of the puzzle, and each person's puzzle might look a little different, and the pieces might look a little different, but all of these pieces will work together.
Yes.
I know we're kind of coming towards the end of our time here, so if anybody has any questions, put them in now. We've got about time for one or two more questions. I know you spoke a little bit about homelessness and housing insecurity. We also know with mental health and substance abuse, those all three, you kind of talked about how all three come together. I know on the campus that we're kind of focusing on mental health and substance abuse. and that's great. Um, what components, let's say if somebody interacts with somebody that might be housing aid, what opportunities do you guys have when you're interacting with somebody that might be housing insecure, that has a mental health or substance abuse issue? What are you doing in that homelessness or housing insecure space? Such as, do you refer them out? I know it's not on campus. What does that look like for you guys?
Because we don't have the campus or the physical location down, we don't have that established yet. We're still relying very heavily on our programs, Humankind, Open Door, and the Union Rescue Mission, who have been working with this population for years now. I remember in my old job, I would go to Open Door and make it accessible for me to be there for my clients that I was working with that are severely and persistently mentally ill or struggling with a substance use disorder. So I know that they've been working with this population. They are working close with us so that we can ensure that all programs are running to the best of their abilities. They're sharing with us what we can do to help them and vice versa. So we definitely couldn't do this without them. It is a big piece of the puzzle, but it's not the only piece to the mental health and the substance abuse crisis situations here in Sedgwick County.
Definitely. Well, I feel like I learned a ton today. I feel like I'm also very empowered and inspired to be able to go out and have these conversations, as well as to be able to know what resources and where to find resources in our community. I think that's the coolest thing that you guys have pulled together, is you have a lot of resources that people can attach to be able to share with those that are in need and in crisis, or might just want to know more about their community and where they can support. So I so appreciate, and I know all of us here do, all of the work that you have done in this area and that you all continue to do. So thank you, thank you.
Well, thank you so much for having me.
You are so welcome. So I just want to share with you all just a little bit about what's coming up next with League of Women Voters. We are excited because next month we are going to be in person. So when we're thinking about the end of the month, the fourth Monday of April, we're going to be looking at April 25th. We're going to be in person at the Learning Center Library downtown. So look out at our Facebook for more information. We're going to be learning more about judges and the election process and the appointment process of judges in our community and in the state. So please come back and learn more. And we are so excited to be back in person. Thank you all for tuning in today. I hope you learned a ton of great information, and I hope you have a great rest of your day and the rest of March, and happy April. Thank you so much. Bye-bye.